ophthalmologist. I've been an ophthalmologist for 17 years now. I work at Kaiser Permanente, and I'm currently the assistant chief of ophthalmology. I've basically been working there since I graduated from my residency program. But other than being a full-time ophthalmologist, I am also a full-time mom of two high schoolers. My son Caleb is 17. He's going to be a biomedical engineering, going into biomedical engineering. And my daughter is 15, Kaylin, and she's actually in 9th grade at Patola High School. She's a great basketball player. Now, just want to briefly tell you, my journey of becoming an ophthalmologist. I really loved animals since I was little, and I still do very much now. And you can see in this picture with my dad taken at my 7th birthday that all my birthday gifts and cards are animal related. That's how much I loved animals. And after urging my mom every day to have a pet, I finally got a white rabbit, which I absolutely loved. So I can tell you that at that time, I told everyone that I'm going to be a vet so that I can take care of animals and help animals every day. At that time, I vividly remember my mom told me one day when my grandma was sick, she said, "It's great to help animals," she said, "but have you thought of helping people? Being a doctor can be very meaningful." That's what she said. And at the age of 7, I did not know anything about what the word meaningful means. I could sense that it is something very good, something that will make a difference. And that idea really appealed to me. And on top of that, my uncle, who was a physician, told me that medicine is not for girls. And I think what he said actually made me even more determined to go into medicine. And so since that time, I knew I wanted to be a physician. Now, but it wasn't until junior high that I really got a glimpse of what the word meaningful really means. I was attending school in Hong Kong, and school in Hong Kong is actually very much like school here. You actually have to pick a book for independent reading every month. And one of the books that I read was this one, which I still have a copy on. Is basically an excerpt of a diary of a Christian doctor in Hong Kong. And so he recorded his encounters with patients that are suffering from different medical conditions and social issues. And the story that I remember most was his interaction with a little girl that was suffering from leukemia. And although he was not able to cure her, he was able to give her hope and her parents hope throughout the process. And so the stories really opened my eyes to the true meaning of meaningful. That is to give someone hope even in situations that are otherwise hopeless. And so at that time, I was really excited to know that being a physician would actually allow me to do that. So after high school, I went to college at UC Irvine. I majored in biological sciences. At that time, you actually don't get to really specialize in which biology you want to go into. So it was just biological sciences. And I was blessed to graduate with first honor, and I was accepted to UCLA for medical school. Now, and while I was in medical school, I was preparing myself to be a pediatric oncologist to treat children with cancer, just like the doctor in that book. And I was invited to go to a National Institute of Health to do cancer research as a medical student. And my research project actually earned me a scholarship that paid for the rest of my medical training. And while I found cancer research extremely interesting and very stimulating, I ultimately realized that I actually want to go into a field where I can see immediate results and will be able to help people around the world, especially in developing countries. And so ophthalmology and eye surgeries would actually allow me to do that. And so upon graduating from medical school, I stayed at UCLA to complete my residency training and finally became an ophthalmologist. And I've been an ophthalmologist for 17 years now. Now that I have told you about how I became an ophthalmologist, I bet many of you will have this question. What is an ophthalmologist? Now, let me ask you this. Do you know the difference between an optometrist, an optician, and an ophthalmologist? Well, no worries if you don't, because even my friends who are in medical field often confuse those terms. Obviously, they're all related to eyes. Now, how many of you wear glasses or contact lenses? If you do, can you wave at the camera? All right. Yeah. Anybody else wear glasses or contacts? So that's quite a few of you. Now, if you have seen an eye doctor for glasses or contacts, chances are that you have seen an optometrist. So an optometrist is, they're not physicians, but they are eye care professionals who specialize in measuring people for glasses and contacts. They also do eye checkups and they look for eye diseases. Now, when the optometrists give you a prescription, then you will actually go to the optical shop and the opticians there will be the one who will help you pick out frames that you want or order glasses for you. Now, if the optometrist looked at your eyes and thought that you have some issues going there in your eyes, then they will be referring you to us, the ophthalmologists. So ophthalmologists are fully trained medical doctors who upon graduation received additional training in everything about eyes. So we diagnose and treat different eye problems, including glaucoma and macular degeneration that you probably have heard of. We also do procedures in the office, like we remove eyelid lesions, we correct droopy eyelids. We also do laser procedures in the office. So what you see here is actually a laser machine that is very small, but it's actually very powerful. But the best part that I like most of being an ophthalmologist is actually doing eye surgeries. In the picture is me in the operating room doing cataract surgeries. And while I'm in the operating room, I actually get to work with a team of very wonderful people. There's always a scrub technician with me who will be passing instruments out for me. And so on the surgical table here, you can actually see the instruments that I would typically use for cataract surgery. And I will always have an anesthesiologist with me as well. An anesthesiologist is a physician who specialized in keeping people comfortable during surgery. And so in the picture, you can see him getting ready to give the patient some medicine through the IV. I also usually will have at least 2 registered nurses with me in the room to help me get the patients ready and to mix up medications for me. So why do I like doing cataract surgery so much? Well, because it really improves patients' lives tremendously. Cataract is the most common eye problem in the world. If you live long enough, you will have cataract. And cataract is the lens inside your eye that becomes hazy. I don't know, does my pointer work during the presentation? It does? Okay. So the cataract is actually basically your lens inside the eye that becomes hazy over time. And so with the hazy and cloudiness in the lens, it makes it difficult for people to see. And when it becomes very cloudy, like this one you see here, a person is basically blind. Now, and in developing countries, a lot of more senior people, they will actually lose their livelihood just from cataracts because they can't see well enough. And when you have a person who couldn't see, that may also mean that you have a child that cannot go to school because they'll have to stay home and take care of their grandparents. So this scene here is actually not uncommon in developing countries. Now, cataract surgeries can solve this problem really quickly and painlessly. Now, during cataract surgery, I will place a probe inside the eye. This probe will actually transmit some high-speed ultrasound that will break up the cataract into small pieces so I can remove it. But the tricky part is that I will only want to remove the meat of the cataract, and I will actually want to leave the very thin capsule that surrounds the cataract behind. I cannot damage it because that capsule will be what will be holding the lens implant. This lens implant is basically an artificial lens that we put back in the eye for people to focus. Now, and once the cataract surgery is done, I would say that most patients will typically see very well the next day. And they will often tell me that having cataract surgeries done is one of the best things that happen in their lives. Now, other than cataract surgery, I also help people who have eye injuries. One of the injuries that we commonly see, unfortunately, is hyphema, which is having blood or bleeding inside the eye. Any blunt force that hit the eye can actually cause hyphema. And nowadays, the most common situation that I'll see hyphema is associated with those elastic exercise bands. I bet at least some of you will have those at home. And when they snap, it very often can hit the face and actually hit patients right in the eye and can cause hyphema. I've seen quite a few of those cases. Now, I'm showing you the CT scan here. This is another eye injury that I've seen. Let's see if you can actually identify what's wrong with the eyes. Can you see what is different? Oh, sorry. Now, if you focus on the lower picture here, the lower scan, you can actually see the two eyeballs, right? This is actually the right eye and this is the left eye. And in the left eye, you can obviously see that there's something that's lighting up big time in here. So this is actually a BB gun pellet that got inside the eye. If you look at the top scan here, you can actually see where it travels to. Traveled through the front part of the eye and got into the back. So unfortunately, we weren't able to save this person's eye. Now, so if you don't remember anything that I talk about today, at least I want you to remember to protect your eyes. Very important. If you are, playing any sports, or playing with fireworks or exercising, anything, anytime that there is a chance something will hit your eye, please wear some eye protection. Very important. So how can a person become an ophthalmologist? A lot of education and training is required. So after high school, you will want to attend a four-year college. While most people who are interested in going into medicine will major in science or one of the STEM majors, it's actually not required. You do have to take courses in math, physics, chemistry, and life sciences to satisfy the requirement to enter medical school. But I've known plenty of people who managed to take all those classes while majoring in things like literature or psychology. And while you're in college, you definitely want to do volunteer work, especially in the medical setting. So to really, at least for yourself, to get a feel of whether that's something you're interested, also to show people that you're committed in this area. You will also want to do some research with a professor. That's something that the medical schools want to look at. Towards the end of your college, you'll want to take the MCAT exam. The MCAT exam is just almost like taking SAT in high school. The MCAT exam will basically evaluate you to see if you're ready for medical school. And medical school will look at the scores for MCAT and your GPA to determine on acceptance. Now, after college, that will be 4 years of medical school. Now, the first 2 years of medical school is usually lecture-based. You'll learn things like physiology, microbiology, pharmacology, and so on. Now, the most memorable class is always anatomy, where you actually get to dissect a cadaver. During those months, you usually dissect the cadaver over like a 6 month period. And during those months, you will always smell like formalin, which is the chemical they use to preserve the body. And so wherever you go on campus, people will actually know that you're a medical student because you smell like one. And the last 2 years of medical school is usually clinical rotations. You'll get to rotate through different departments in medicine, like internal medicine, pediatrics, OBGYN, and different surgical subspecialties. You'll learn to interview patients, examine patients, diagnose and treat different diseases. Now, after medical school is internship. As an intern, you will start seeing patients by yourself. But since you won't have much experience at that time yet, you'll be working closely with other doctors who are more seasoned and experienced to learn the art of medicine. And internship is usually in general internal medicine or general surgery. Most patients' idea of internship comes from TV shows like Grey's Anatomy. And so people often ask me if internship is really like what the TV shows. I can tell you that that is usually not as much romance, but the complexity of the diseases and the drama with social issues is actually very real. And when there's a cold blue, we do run down the hallway to save lives. So it does keep your adrenaline running. So after internship, then it is residency. You'll get training in a specific area of medicine that you have chosen. If you're going into a more general area of medicine, then like family medicine, internal medicine, or pediatrics, then you'll have 2 years of residency beyond your internship. For other specialties that are more specialized, then it will range from 3 to 5 years. For ophthalmology is 3 years of residency. And during that time, you'll learn everything about eyes, all sorts of eye problems, how to treat them, and you'll also learn how to do different types of surgeries. So I know what you're thinking. It's a long time. And it's true. By the time that you're done with all your training, you'll probably be around 30 years old. And I know that sounds really old to you. But I want to remind you that you are actually already halfway through your training because you already completed kindergarten, you had elementary school, you had junior high, and maybe you already have 1 to 2 years of high school. And so that's actually already half of the training. And you don't have to wait until you're done with all your training for your life to start. Most of us get married, we have kids, we start a family while we're still in training. And the process of the training is actually packed with actions. It's never boring. You do work very hard, but you get to see a lot of interesting cases. You get to meet a lot of interesting people. And so there's never a dull moment. So you should definitely enjoy the process. Now, I think most importantly, having a skill that you're able to help others will really open the door for you to do a lot of good work around the world. This is me in Haiti the year after the huge earthquake that destroyed most of the country. I got to help a lot of people, including this boy who was born with blindness in one eye. I also went to Mexico a few times. Over there, we'll basically set up tents that are like these, and we get to check patients' eyes. We give out glasses. And while I am checking people's eyes, then my daughter, Kaylin, was helping other children by checking them for head lice. 2 summers ago, we were in Tanzania. We also get to do some free clinics over there. And you see Kaylin playing with the children in Tanzania. And she was also helping to educate people on personal hygiene. And then my son is checking eye pressure here for this patient to screen for glaucoma. And then I was showing this medical student how to do eye exam. The year before COVID, the summer before COVID, we get to go to El Salvador with the Global Health Outreach, which is a great organization that does a lot of good work globally. So we had a team of high school students and eye care professionals. Well, we did a lot of eye screening. We passed out more than 1,000 pair of glasses. The 4 teenagers you see on the first rows here, they were actually the high schoolers that were in El Salvador, and they served as our translators. They were definitely some of the brightest and most energetic, most hardworking teenagers I've met. And it's definitely fun to see my kids being involved in this effort as well. Now, if you are interested in becoming an ophthalmologist, and I hope that you do, here are some of the things that you can do. First of all, definitely do your best work in everything that you do. I'm not talking about just getting good grades. It's true that you need a good GPA to get into medical school, but I'm talking about even things that you don't get graded on. Just consider this, your patients expect you to give 100% every day, and they also expect you to be 100% correct every time. So you want to practice in doing your best work in everything that you do. So that includes your schoolwork, your extracurricular activities, whether sports, music, even the house chores that your parents assign you to do. You want to put in your best effort and do them the best that you can. Other than that, you also want to learn how to communicate with other people. As an ophthalmologist, I see 25 to 30 patients a day. They come from different cultures, different backgrounds, and it is important for me to be able to communicate with them and connect with them within a very short period of time. So that will require you to put your phone aside and start really learning how to communicate with people face to face. And I think most importantly, you want to practice empathy. So what is empathy? So empathy is to understand the feelings of others and be able to put yourself in someone else's shoe. So it is ability to show care and concern. Now, because people don't care how much you know until they know how much you care. With 20 years of being a physician, I learned that that's definitely true. I found that the most successful doctors are the ones who know how to connect, know how to show care and concern. And I've met physicians who graduated from the most prestigious medical schools and have all the knowledge in their heads, but then they lack the skills to communicate and connect with patients. So even medical schools nowadays realize that too. So when they pick applicants to go into medical school, they just don't look for people who are good at organic chemistry, but now they also look for applicants who have people skills and who can embrace diversity. So I will definitely encourage you to go meet and talk to people of different backgrounds, people who are different from yourself. Now, I'm not suggesting you to go on social media right now and start talking to strangers, so please don't do that. But hopefully the pandemic will be over very soon, and you'll be able to join an interest group, involve in the community, expose yourself to different cultures, and do volunteer work to help other people. That's very important. So now that I've shared with you all the cool and meaningful stuff that you can do as an ophthalmologist, I hope you will all consider pursuing ophthalmology or other medical fields. I know that as a fact that in about 10 to 20 years, I will need some good doctors to take care of me. So I hope it will be you. Any questions?
Students, feel free to ask questions or you can type them in the chat. Either one works.
Any one of you particularly interested in ophthalmology or any fields of medicine? I have a feeling that if you are attending this session, you're probably interested in that field, right? Yeah. If you have no questions, you can also share with me as to, what field of medicine you're interested in. I can definitely tell you more about that.
On the chat, Mom.
There's one question in the chat. I don't know if you can see it.
I see. I actually...
It says, so same for optometrist and ophthalmology is the process from college to internship to residency, and then to the end result of being an ophthalmologist or optometrist stressful? Also, is the years of residency the same?
Yeah, so for optometry, after 4 years of college, you actually go to optometry school for 4 years. So you actually do not go to medical school, but it's a specialized optometry school. And after 4 years of medical school, then you are actually, from what I understand, you are a fully licensed optometrist. So there's no further residency training unless you're particularly interested in a particular area of the eye. And the other question is there a difference as to the end result? I think, is that the question?
Well, the question was and my other question was, do you have to take MCAT for optometry?
No, you don't have to take MCAT for optometry. So MCAT is only if you want to go to medical school. Yeah. I actually do not know all the details of applying to optometry school, but that's definitely something I can look up for you because I do work with a lot of optometrists. Yeah. So maybe I can, once I found out the information, maybe I can email to Jacqueline.
That would be great, and I can push it back out to students as well.
Yes. And I think there was one last part of your question. I'm sorry, unfortunately, I couldn't see the chat here.
I was just asking if the whole process is really stressful, or how the experience is.
Yeah, so whether it's stressful, I can tell you that if I were to look back, probably the more relatively stressful part is actually in college, applying to medical school, just because it is quite a competitive process. So you want to have good GPA, you want to have research experience, you want to have volunteer experience. And on top of that, then you want to take the MCAT. So you are very busy. But once you get into medical school, I would actually say that is more fun than stressful. Once you're accepted to medical school, the school do expect you to graduate. Meaning that unlike law school, where they will admit a lot of people for the first year, and then every year they actually cut the number of people. So they actually will, through the process, kind of screen out a lot of people. So that is very stressful. But for medical school, if let's say they accept 100 people for the first year, they do expect all 100 people to graduate. So they really help you to get through. And for people who feel that they're falling behind, there's usually a lot of help and support. And in medical school, the majority of them is not a grade system. You no longer get A, B, C, D, and F. A majority is just pass, fail. Because they realize that anybody who got into medical school used to be straight A students. They know how to study. They know how to motivate themselves. So they actually take the grade system away so not to create more stress. Because for people who are that are used to getting A's, if you get them a B, it will be very stressful, right? And so they actually totally get rid of the grade system. And so, so again, I think medical school is actually very fun. As we talked about, you get to see a lot of interesting cases, and you know that you're already in the program, and so you know that you're going to graduate. So it's actually not very stressful. You do have to spend a lot of time to study because that's a lot of things to memorize. But I have a feeling that most of you, if you are in high school, you're used to studying, I don't think that you'll have any problem.
When you were in college, what did you major and minor in?
So I majored in biological sciences. I actually did not have a minor. But as we mentioned before, what you major in is actually not most important. I do know a lot of people who major in many different things while in college. As long as you satisfy all those requirements of the courses they need, then you can actually major in anything you want. Sometimes medical school may even want to see people who major in something as outside of science, because they really want you to be a very broad person. They want diversity. And so sometimes if you major in something like things like fine arts and stuff like that, they may even actually like that. So I would say ultimately major in something that you are interested in.
So if you major in something that's like not related, like if you major in fine arts, then would you like minor in like something related to science then, or?
Right, it's true that you do need to take all the math, chemistry, physics, and the life science courses. So in order for you to have enough time to do all that, so most people end up majoring in something like science, or at least minor in some science field. That's true. If you do want to major in something very much different from the sciences, then you do have to manage your time very well, just to make sure you can fit all the classes in.
Great. So we have another question from the chat, and this student isn't sure if you'll know the answer, but because it's a little bit different, but how long, if you know, does it take to become a dentist, and what are the procedures if you're aware of anything?
I know a little bit about dentistry. After 4 years of college, you want to go to dental school, and it's 4 years of dental school. I'm actually not sure if there's an internship or residency program after that.
Thank you.
But then,
And
yeah,
then,
it will be a dental school.
and then another student is asking, where did the research experience come from?
Most students in college, when they go take certain courses, if they found that the professor that's teaching the course is actually researching in an area that you're interested in, what you can do is that you can actually approach the professor and ask if you can do research with them. So most students actually find research that way. That's how I did it as well. I basically did research with professors that I have taken courses with. Most colleges, they also have a database. Back then when I was in college, it was like a folder. Now I'm sure it's a computer database that will list like all the professors and all the research projects that they're doing. And so sometimes you can just go through that and pick out projects that you're interested in. And you basically will want to approach the professor and ask if you can do research with them. And most professors are very open to having students do research, just because they don't really have to pay you. It's kind of like free work. And then obviously they want to provide you with the learning experience as well.
Another student just asked, how competitive would you say that ophthalmology is?
So compared to other fields of medicine, ophthalmology is considered one of the most competitive. The more competitive field is ophthalmology, dermatology, orthopedic surgery, radiology, and sometimes people say anesthesiology. That fluctuates. The reason why ophthalmology is a competitive field, first of all, because compared to other fields, we probably don't have as much emergencies. So when we don't have to take call too often, I do have to take call once in a while, but not too often. The other thing I think ophthalmology is appealing is because of really the type of surgery that we do, that most people are very happy with the results. Unlike some other surgeries or some other medical issues that it's sort of a chronic issues that you can never really solve or completely cure it. In ophthalmology, there are a lot of things that we do that we can actually completely solve the patient's problem, just like cataract surgery. So I think that that is just really satisfying. That's why a lot of people want to go into ophthalmology. Another reason is that there is not a lot of ophthalmology residency program, not a lot of positions for that, because I think they do try to regulate the number of ophthalmologists that are in the country. So because of that, then it tends to be a competitive field. So for people who are in medical school, and if they know that they want to go into ophthalmology, they probably want to do some research with the ophthalmology professors during medical school. I actually didn't do that because when I was doing research, I was actually doing cancer research. But I think if you're overall, you're a good medical student, you really show your interest, you show that you're dedicated in that field, you'll get in.
What is like? Do you think you should do a lot of volunteering, like in like with like internship or volunteering for research a lot during college, or?
Yeah, I think if you are interested in going to medicine, you definitely want to do a lot of volunteering. I think volunteering is beneficial, one, because you want to make sure that that's what you want to go into. So you can actually volunteer in medical settings, whether it's volunteering in the hospital, in the doctor's office, or even volunteering at like health fairs. You'll be able to kind of like get a sense of what is required, get a sense of how interaction with patients are like. So you want to make sure that that's what you're interested in. Also, volunteering will allow the medical school to know that you're really interested and committed in that field. I can't really tell you as to how much volunteering is good enough, but I would just really suggest volunteering probably continuously throughout college, and also volunteer in different settings. And even when you get in medical school, I will say it's also very important to start working and shadowing different doctors. For me, I do find that during medical school, I feel that I didn't really know what exactly I want to go into until pretty last minute when I have to decide. Just because different field of medicine is actually very different. Ophthalmology is very different from family medicine, very different from general surgery. So you want to actually early on, even in college or even in high school, if you've got a chance to shadow different doctors in different specialties to really get a sense of what different people do.
A student just typed in, said, what do you mean by shadow?
Shadow means that you actually follow a physician and just observe what they do. So we call it shadowing. So you kind of like the shadow of a person. And it is true that it may not be easy to find an opportunity to shadow as a high school student, or even as a college student, it may be difficult. It may be getting more difficult than what it used to, just because there may be more regulations in privacy and stuff like that. So it maybe not all patients will let a non-medical person come in the room with the doctor. So it may not be easy to do that, but probably if you can start like asking around whether you have any family friends who are physicians, or start out with just volunteering in maybe a medical center, in the gift shop. Maybe it's not exactly a medical experience, but just work your way through with those steps and see if then from the gift shop you can start maybe, do something like transporting patients, and from there maybe you will have more opportunity of really observing the real life actions in the hospital.
Another student asked, when you first find work as an ophthalmologist, do you have to work up to higher positions?
repeat the question again?
I'm sorry. When you first find work as an ophthalmologist, do you have to work up to higher positions?
I see what you're saying. I think I'm very fortunate. Basically, even before I graduated from my training program, I was already offered the position that I'm at Kaiser. I do know that there are some ophthalmologists who, upon graduation, may be working like part-time with another established ophthalmologist first, and then maybe then slowly work their way up to become like a full-time ophthalmologist. And then they may even become what they call a partner of their practice, where you actually get an opportunity to buy into part of the practice that a private doctor has. So I think everybody probably go through a different process. In a way, again, I'm very fortunate that I was able to get a full-time partnership straight out from my residency program.
And another student asked, how would you recommend navigating research, volunteering, shadowing, and exploring medicine passions under current COVID circumstances?
I know it is very difficult. And even my two teenagers, they used to do a lot of volunteer work on a regular basis. Right now with COVID, it's very difficult to find that opportunity. I would say that during this time, probably what may be more feasible is probably, through more like personal connections, meaning that, you can ask to see if your parents know people who are in the medical field that can kind of like just talk to you and share with you their experiences. Sometimes I know that there are certain interest group where all the high school students that are interested in medicine will come together, and they may, as a group, be able to, have access to certain speakers that can speak to them. But it's true right now, it is difficult to find volunteer opportunities.
Thank you. And another student asked, how long does it take to reach the point of getting your own practice?
Mm-hmm. Mm. That is something that, again, I didn't quite have a personal experience because I was basically joining a large-scale medical group right off the bat. But I would say that probably for most of my friends that I know of that graduated with me, I would say probably about 3 years. Even if you were to join somebody's private practice, it's usually a 3-year process where you become a partner. So basically during those 3 years, basically the other senior doctors will kind of observe how well you are performing, how well your surgical skill is, and as we mentioned, really how well patients like you, as to how well you can communicate and connect with them. And so based on that, then they will offer you a partnership.
And another student asked, how tough are ER situations?
How tough are ER situations? Are we talking about like, doctors who specialize in emergency medicine, as to whether it's difficult to get into that field? Is that what the question is?
I'm not sure. The student who asked the question, if you want to specify. Hopefully they will follow up in the chat. Oh, if you have an ER situation.
Oh, okay. Like if, I assume you may be talking about like as an ophthalmologist, if we have an emergency situation, what we do. There are several things that we see that are considered like emergencies in terms of eyes. One is eye injury, like the ones that you saw with the BB gun injury in the eye, where we call that a ruptured globe, meaning that your eyeball is actually ruptured. So that would be an emergency. Then we'll have to see the patient right away. We'll have to take them to surgery right away and hopefully be able to save the eye. Another emergency that we see is actually acute glaucoma, where patients all of a sudden have a really high eye pressure inside the eye. They'll have a lot of pain. They will be like vomiting. And if we don't get to lower the eye pressure fast enough, the eye can actually go blind within a few hours. So those people will want to take them to do a laser procedure on them right away. Usually with that, we call that, we'll break the glaucoma and the eye pressure will come down. The other type of emergencies will be like retinal detachment. That's also something that we commonly see, where patients all of a sudden start seeing a shadow in the eye, and then actually they kind of like gradually lose vision over weeks and over hours and days. Those patients, we also want to take them to surgery within a few days to repair the retina for them. I hope I answered your question. If you have anything more specific, you can ask more. Mm-hmm. Any other questions for me?
Any other questions, students?
There is one more in the chat.
Oh, I see it. Okay, it says, so in conclusion, ophthalmology, for be it any medical career, it is 80% knowledge and 20% personality to be the best. Is that correct?
I would actually want to say it's the other way around. I would say actually 80% personality and 20% knowledge. I mean, that may sound scary, but I can tell you how much of the things I learned from medical school that I actually use on a daily basis. I actually don't use most of them. Most of them is more like a background information, meaning that, hey, if something comes up, I'll be like, hey, I know that I should look this up, and then I'll look up the internet for more detail. There's no way I'm going to remember everything I've learned from medical school. But what I found that is really most useful is really know how to talk to patients, how to show them that you do care, and how to communicate with them and convince them that your treatment option for them is good for them. You know, every medical student will tell you that they will know doctors who are very popular, meaning that there will be people traveling around the world to come see them. You see celebrities coming in to see them. Those may not be the doctors who know the most, but they are definitely the doctors that know how to communicate and present their findings, and they are convincing. And those are the doctors that patients trust, and those are the doctors that patients like. And also, if you can actually convince patients that your recommendation is good for them, that's when they will really follow your recommendation and get better. And so being able to communicate, being able to convince is very important as a physician.
Okay, we have two more questions I think we have time for. Can you recommend any places to do volunteer work?
At this time during COVID, no. But after COVID, you can actually, every hospital will actually have a volunteer office. They will have a volunteer coordinator. Something that I would think that you'll be able to look up the hospital website and be able to identify. So you may want to like email that person or call that person. It is difficult to find because a lot of people are interested in that in medical field. So a lot of people are looking for volunteer work. Sometimes there may even be a waiting list. So you may have to be pretty consistent. You may have to check in quite often to find an opening. I think another great way is to actually go overseas. If you have the opportunity to go overseas with a group, like my kids and I, we have been with some volunteer groups over the summer several times. And those are great opportunities to get hands-on experience, because you often actually get more hands-on opportunity when you're in other countries than in the US. Because here there's a lot of regulations. So when you're overseas, you actually probably get to do more. And so you will basically, I would say around like February or March, you'll probably want to go up the websites and you can search overseas volunteer opportunities for high schoolers. And you'll see that there are actually quite a few organizations that will actually take high school students. And those are definitely a great experience. Not only do you get to see, be exposed to the medical field, you also get some cross-cultural experience.
All right, and last question. What is the minimum GPA you will have to have in order to get accepted into a good college for the medical field?
You mean to get accepted to medical school, or to get accepted to college?
Does the student want to clarify? Medical school.
To medical school. There's never a minimum, let's put it that way. But what I've seen, you do need really good GPA, like something like a 3.8 or above. It is a competitive field, and they do want to make sure that you are a person that can consistently put out good work. That's what we talked about before. And I think that's why GPA is important, because usually people who are consistent in doing their best work usually have good GPA.